Good morning. Today is April 14th, and this is an update with the COVID-19 pandemic. I found some more information that I thought would be useful to share because with more information and more statistics, we can help policymakers at the city level, county level, state level in Florida, and perhaps even national level to help us of how to cope with COVID-19 and the policies that are enacted of like telling people to shelter in place, telling non-essential businesses shut down, like restaurants. So we need this information to help us with going forward. And also, I would just like to share that since I've been in the IT field, software and programming and all that, when you complete a project, typically you like to do a lesson learned to see what could we have done differently to improve what we went through in this project. A lessons learned of like improving the process. So this is something that we probably should do. Look back of how we handled this pandemic crisis. So what I have here in my screen is again today's the 14th of April. On April 13th, 2020, at USF, I guess health related here. There was a faculty member at the USF Health College, okay, of Public Health, and he's among the authors of a new study that shows that far more children are likely to be COVID 19 positive than has been reported. So I've actually highlighted the most important part here. For every child who requires intensive care for COVID 19, there are likely almost 2,400 additional children that are actually infected. That is staggering to me. And there's a positive spin on this, but let's talk about this a little bit more. So just to repeat, for every child that is actually reported in intensive care getting over this COVID-19, they believe there's an additional almost 2,400 children who are actually infected with no symptoms. So on the negative side, that means that if that child is visiting an elderly person or someone who has underlying compromised immunity system, that they could have symptoms of COVID-19 because that child, in other words, could be a carrier, right? That if we would test one of those 2,400 children, it would show positive, which means there's a period of time that they're contagious. So that's the negative side that they could share it with grandpa, grandma, who may have underlying conditions or a weaker immune system, and then they could have a tough time with the virus, if not dying from it. So that's a negative side. On the positive side, let me go back to my spreadsheet that I've been sharing. Scroll up here. In my previous reports, I've been mentioning that I decided to inflate what's been tested in Florida. So yesterday it was reported that 19,895 people have been tested positive in the state of Florida, and I'm increasing that to this value based on 50% more. And as a recap, the reason why I did that was I have learned that there was a study that was done. They in Iceland they tested healthy people. A second group was on a cruise ship where they tested apparently everyone on the cruise ship that also had healthy people. And the third group was some town in northern Italy where they also tested healthy people. They looked at the healthy people that were tested, and 50% of them tested positive with no symptoms, asymptomatic. So that means that there's probably more people infected, of course. And the question is by what percentage? And we now have a 50% from that report. However, when we now look at this report, that every child who's in intensive care due to COVID 19, there may be an additional 2,400 rounded up. So that supports the 50%, or it could be even higher. But let's keep it at 50% for now. And the positive side of that is the following: when more people are infected and get over it, either systematic or asymptomatic, it is believed that they have antibodies. And once they have antibodies, that means they're no longer contagious. And so if someone else with COVID 19 with that exact same strain comes to the child, they're not going to be tested positive because the antibodies are quickly saying, nope, not today, right? The only other possibility is if there's a different strain of COVID 19, then in theory they could be positive again for that strain and repeat that whole process over again. So that's that argument. So again, the more people who have it and spread and can't spread it anymore because they have the antibodies, the quicker we reach the peak or the apex, the quicker we come down. And then, as we could tell, as reported yesterday, it's been going down with new cases for at least 4 weeks now. So we're kind of coming down from the increases. The other thing I wanted to point out is another topic: flu deaths. Yesterday, I had 300 here. So there is this floridahealth.gov PDF file, and I had 300 there. So let's go over there real quick. So in figure 4 in week 13, which happens to be ending April 4th, the number of pneumonia influenza deaths identified statewide decreased slightly compared to other years, and other years are noted here. And the time frame they're comparing is a typical flu season, which is usually fall through spring. So week 40, week 52 represents the last week of December and so forth. So I figured out that this notch here represents the first week of January. So if we go up to January, scroll up here a little bit, it looks like it's around 300, 300, 300, dips below 300, 300, a little bit higher, 300, dips a little bit below. So even in worst case, if we say from January, because we want to kind of do apples and apples here, we take January to present and compare COVID-19 deaths versus the flu. It might be interesting to see that that comparison. So what I misreported yesterday was on week 13, which ends April 4th. I said, well, that's 300, so I put 300 in here, but that's not correct. I'm supposed to take January 1st and add about 300, 300, 300, whatever, and accumulate that. So what I did was I underreported with an average of 250 here, which is below this line. So I'm being conservative. So I counted 13 weeks since January. So 13 times and below average that we see, let's say 250 per week have died from the flu. That becomes 3,250 deaths from January to now compared to 221 here. So on one hand, you're saying, well, why are we overreacting if there's more flu deaths than COVID-19? And on the other side, it's because COVID-19 is much more contagious. And when you have much more uh, contagious state, that means there's a chance that too many people are going to the hospital at the same time, overloading the resources. And then if you max out at a specific hospital, if someone wants to seek care, but there's no place to put you, then there's a greater chance of you dying. So we're trying to reduce the deaths and also not overstressing the people and the resources there. So that's the two sides. So just like I said in IT project management, you usually do a lesson learned. So we need to look back and see how we can improve the process going forward. For example, if there's a second wave in the fall of 2020. So if I was going to jump into the lesson learned stage, I would say that we've never gotten close of overwhelming hospitals. And as I said yesterday, you really needed to do it per hospital, per community, per town, then go up to per county, then per state. But generally, at the state level, we never came close of overwhelming the healthcare system in the state of Florida. So I would say the two indicators from this lesson learned to determine when to tell non-essential people not to go to work would be how fast of a rate is it approaching maxing out the resources, and two, where are we? Because right now, I don't know why no one is sharing on a daily basis how many available beds and vents there are. We're just accumulating the whole thing. So in this case, in the worst case, row 10 here is said since the past 4 or 5 weeks, 2,672 have been in hospital beds, in this case, in the state of Florida. But of course, some of those people have recovered to the point to leaving the hospital. And unfortunately, some of them have died. In this case, 461, freeing up the resources. But in the worst case, if we assume that everyone who went to the hospital since 4 or 5 weeks ago are still there in worst case, we're nowhere near of maximizing out our resources of beds in this case. So the lesson learned is we need to come up with a threshold. Let's say it's 80% that we should start, or let's say even 90%, or let's say 80%. If we come up with 80% of adjusted beds available, or in this case, it's opposite. If it comes down to 20%, then say, wait a minute, we should create public policy to tell non-essential people to stop going to work. But we're not there. We're not at 20% or 80% on the other side. And then the rate hasn't been that bad because it's decreasing, right? Percent change is dropping. It's dropping. So right now, based on that reasoning of lesson learned, non-essential businesses should be open right now at this moment. So looking in the fall of 2020, if there is another wave of the pandemic, we should have something like this in place to not overreact where they are shutting down non-essential businesses. Thank you for your time.